Lorie out loud.
Hey fam, before we dive into today's episode, I've got one quick favor to ask that makes a huge difference. If you like what we're doing here at Lorie Out Loud, go ahead and hit that subscribe button so you never miss a beat, a laugh, or a featured guest. New content is dropping bi-weekly, and trust me, you want to be here for it. If something in this episode speaks to you, hit that share button and send it to a friend, a sister, a brother, or your art-loving cousin. Let's spread the love. Thank you. Hey, beautiful people. Welcome back to another episode of Lorie Out Loud, the podcast where voices get amplified, culture gets celebrated, and creativity takes center stage. I'm your host, Lorie Jean Akambi. And today's episode 5 is packed with rich storytelling, colorful design, and a few surprises that might just make you smile or learn something brand new. First up on Fashion View, we're stepping into the swish and sway of a custom-made maxi dress stitched by a talented Ghanaian seamstress using authentic Holland Veritable wax fabric in stunning blue, black, and yellow. It's not just a dress, it's tradition in motion. Then, in our featured artist segment, we shine the spotlight on the Nigerian-born artist Njoku, whose 4x4 acrylic painting tells a quiet yet powerful story, one braid, one brushstroke at a time. Trust me, this visual work speaks volumes about legacy, womanhood, and culture. And finally, I'm thrilled to debut a brand new segment called Science Me, where we break down science, health, and wellness in ways that matters to us. This week, we welcome women's health nurse practitioner Jenna Perkins, who gives us the real, the raw, and the empowering lowdown on menopause. No whispers. We're talking openly, honestly, and with care. So grab a cup of tea, a notebook, and your favorite pen or pencil, because Lorie Out Loud is bringing culture, conversation, and creativity straight to your ears. Let's get it started. Hey, I'm stepping into the spotlight with Fashion View. Today we are diving into the story behind the dress I'm wearing. Not just a dress, but a wearable storybook stitched in symbolism. Let me introduce you to this maxi dress, crafted from none other than Holland Veritable wax fabric. A fabric that doesn't just dress the body, but dignifies it. These colors, deep blue, bold black, and sunburst yellow, are more than decorative. They're declarative. They speak of legacy, of power, of illumination in the darkness. Now, let's rewind a bit to the roots of this textile. Though deeply embraced across West Africa, Holland wax has its origins in the Netherlands. Dutch textile makers in the 19th century sought to industrialize Indonesian batik techniques. But when those machine-made fabrics didn't catch fire in Southeast Asia, a new flame was lit in West Africa. Traders and tastemakers reimagined the fabric, made it their own, and the rest, as they say, is runway history. What sets Veritable wax apart is not just its bold color scheme, but the saturation. This isn't just printed fabric. This is wax-resist dyed cotton, designed to hold its vibrancy through time, wear, and meaning. It's called Veritable because it's genuine, the real deal, not an imitation. And the way it moves, well, girl, just watch. Woo-wee! Yes, this dress is architectural, theatrical, and traditional. Perfect for weddings, galas, or simply taking up space unapologetically. The artistry is in the details, the fine crackling of the wax, the layered motifs that change meaning depending on who's wearing it, where, and why. When you wear a dress like this, you're not just stepping into style, you're stepping into a cultural conversation. You're honoring the weavers, the dyers, the grandmothers who wore it before us, and the daughters who will reinvent it after us. Thank you to the seamstress Margaret who made this dress, once again, just for me. So whether you're a lover of print, a student of history, or just someone who likes to make an entrance, Holland Wax says it loud. Fashion isn't just what you wear, it's what you carry. That's it for this segment of Fashion View. Until next time, wear your stories proudly.
Lorie, out loud.
Welcome to our featured artist segment. We're stepping into a world of vibrant color, cultural resonance, and unapologetic Black femininity, all through the brilliant lens of visual artist Njoku. Now, if you haven't heard of Njoku, ooh honey, prepare to be blessed. Born in Nigeria and raised in the United States, Njoku is a painter, illustrator, and creative entrepreneur who is redefining contemporary African art for a new generation. She's part of a wave of young Black women artists reclaiming identity, space, and heritage, one bold brushstroke at a time. Uzo graduated from the University of Virginia with a degree in studio art, and she hasn't stopped painting since. Her work celebrates Black beauty, pattern, femininity, and African design. Think lush textiles, regal postures, expressive eyes, and an energy that makes you feel like each painting is looking right back at you. She's the founder of Uzo Art, a lifestyle and design brand where fine art meets wearable and functional pieces. You'll find her prints on everything from canvases to clothing, even wallpaper. But at the heart of it all, storytelling. And that brings us to today's featured piece. Allow me to describe this visual feast here in front of me. This is the painting, the acrylic painting by the artist Uzo Njoku. Now let's just take a moment to behold. It is beautiful. Now this piece is a 4x4 acrylic painting, again by Uzo Njoku. It was painted during her college days. It feels sort of like a conversation frozen in color. On the right side, we see a young girl, her skin rich and deep, her seated posture gentle yet grounded. Her hands are delicately clasped, and her face wears a contemplative expression. Her hair, partially completed with braids and voluminous curls, flows with intention. I mean, I bet I know what she is thinking, and that's, Mom, or whoever is doing her hair, please hurry with my hair. Woo! She's dressed in a garment filled with circular green and white patterns that evoke traditional African textile motifs. These patterns almost look like a stylized take on Adinkra symbols and even elements of wax print. The colors are lush and earthy and organic. Behind her is a vibrant honeycomb-like backdrop with bold reds, yellows, oranges, and blacks in geometric patterns that scream of African wax prints. Perhaps a nod to the Hollandaise wax fabric tradition that is so loved. On the left, a second figure enters the composition, partially visible. It's an elder, focused and deliberate, braiding the young woman's hair. Her hand stretches out gently, mid motion, a tender act that speaks volumes. The elder's face is calm, concentrated, the kind of expression worn during acts of care passed down through generations. The entire composition feels deeply symbolic. It's not loud, but it is loudly meaningful. It invites interpretation. This piece for me is about inheritance, not just physical inheritance, but the intangible treasures passed down from one generation of black women to the next. The elder, perhaps a mother, grandmother, or spiritual guide, is braiding something deeper than hair: wisdom, tradition, protection, and the young woman receives it in silence, dignity, and power. That red, yellow, black geometric background, it vibrates. It's culture as environment. It doesn't sit behind her, it supports her, surrounds her, raises her. And did you catch the symbol on the lower right? A stylized African comb. Not just a beauty tool, but a centuries old symbol of heritage, status, and self definition. It grounds the painting with one subtle stroke. Njoku's work is part of a larger moment in contemporary art where the African diaspora is reclaiming visual language. For too long, black subjects in art have been viewed through colonial or exoticizing lenses. But artists like Uzo flip the script. In her world, black people don't need to be explained or justified. They just are. Bold, soft, fashionable, sacred. She doesn't paint for permission, she paints for presence. And what I love most is that she doesn't gatekeep her art. Through her prints, home goods, and fashion collaborations, Uzo brings fine art to the people, into homes, onto notebooks, through wearable canvases. Art is not confined to museums anymore. It's in your living room, your wardrobe, your story. Looking at this painting, I think of women in my community that did my hair. Lil Granny is the first one that I think of. May she rest in peace. My Aunt Barbara, Miss Bernice, the local hairdresser, my older sisters. The quiet moments when they passed on culture by simply doing my hair. I also think of the many other women that passed on culture through food, dance, song, fashion, and intellectual knowledge and wisdom. This piece by Uzo Njoku captures that energy, the sacred transmission. It reminds us that we don't just inherit names or features, we inherit meaning. So here's my call to you, dear listeners. Support artists like Uzo Njoku. Don't just admire from a distance. Buy the work, share the name, tell the story. Visit uzoart.com. That's uzoart.com. Follow her journey and maybe bring a piece of her world into yours.
Lorie, out loud.
Welcome to the very first episode of Science Me, where we explore the science that speaks to us and centers our stories. This isn't your typical science chat. We're here to break down the facts and the feelings, to talk about health in a way that's honest, inclusive, and empowering. Today, we're starting with a topic that touches every woman in some way, yet is so often misunderstood or left unspoken: menopause. To help us unpack this, we're joined by a guest whose work is rooted in compassion, education, and clinical expertise. She's a board certified women's health nurse practitioner, a dedicated advocate for patient centered care, and a specialist in sexual health, pelvic wellness, and menopause. Originally from Detroit and now practicing across Washington, D.C., Maryland, and Virginia, she's also a wife, a mother, and a trusted voice in women's health. Please welcome Jenna Perkins. Together, we're going to explore what menopause really means, what it can look like, and how we can navigate this stage of life with clarity, confidence, and care. Let's get into it. Welcome, Jenna, to Science Me.
Yeah, hey, thank you, Lorie. I'm so excited to be here. That was a beautiful introduction, and I cannot wait to get into it.
All right. All right. So let's begin, Jenna, with the foundation. What exactly is menopause? And as you go about explaining this, can you speak to the different phases? For example, perimenopause and postmenopause.
Got you. So menopause really just means that you've gone one full calendar year or 12 months without a period. That's all that means. And the lead up or the drama, the chaos up until that point is called perimenopause.
Mm-hmm.
So perimenopause just means that your ovaries are still producing the hormones, estrogen, progesterone, testosterone. They're still on, you still are ovulating. It might be infrequent, right? Like you might have a period or a bleed every 6 months,
Mm-hmm.
or you might not have one for 2 months and then you'll have another one twice in a month. And so perimenopause is just the drama that ensues until you finally have your ovaries shut down and no longer produce enough to get you an ovulatory cycle that ends in a bleed.
Okay. Okay. Wow. So it's pretty complex there. It
It's pretty
sounds like.
complex. It's pretty
Mm-hmm.
complex, but it's also cut and dry, right? Like
Mm-hmm.
menopause is forever. It just means that forever after that point, your ovaries are no longer going to be producing sufficient hormones
Mm-hmm.
to create a cycle.
Mm-hmm.
And so when you talk about like when does menopause end, it never ends, right? Um, it
So
ends
it
when
never ends because look, that is a myth that, oh yeah, I went through it. Like it's gone, it's done. So it never ends. Tell
it's never.
tell us more about that.
Once menopausal, always menopausal. That just means again that at that point your ovaries are not gonna, you're not gonna magically wake up and then your ovaries decide to turn back on, you know?
Ah, okay.
Um, so menopause and postmenopause, they are the same thing and they are forever. If you believe in reincarnation, you'll get a next set of ovaries and then you start the process all over again. Um,
Okay.
but when people refer to, oh, I went through that, typically what they're talking about is that difficult, it could be 10 years for Black women, that decades long transition to the menopausal point.
Okay. Okay.
Um, and so, people might be like, oh, yeah, I went through that. I had hot flashes, but I don't have them anymore, and now I'm fine.
Mm-hmm.
Problem with that is that the symptoms of perimenopause, of hormone decline, yes, they affect us physically in ways that we can see. So hot
Mm-hmm.
flashes, night sweats, skin changes, weight gain, but
Mm-hmm.
also they affect us internally in ways that we can't see.
Mm-hmm.
So
Mm-hmm.
just because your hot flashes have stopped does not mean that your brain, your bones, your heart are not all still suffering from the loss of hormones with perimenopause and menopause.
Okay. Okay. Um, so why do you think, Jenna, menopause remains such a misunderstood or perhaps rarely discussed topic?
Oh, I mean, this is when we talk about the patriarchy and white
Mm-hmm.
supremacy and
Mm-hmm.
all the other isms of the world.
Mm-hmm.
Um, but essentially, there is really good data around menopause. It's not,
Okay.
I hear people say a lot, like, we need more research, we need more studies. Yes, and
Mm-hmm.
we have a large body of research, a large body of studies that show us what lack of hormones does to your body.
Mm-hmm.
In the early 2000s, a lot of women were on hormone replacement therapy to help with hot flashes, with brain fog, all the joint pain, all the things that can come along with perimenopause and
Mm-hmm.
menopause. And so this Hallmark study, the Women's Health Initiative study came out, and the study was stopped because the headline said hormones are dangerous, essentially.
Yes.
And so what has happened since then is we have reevaluated that same data set, that same literature, and said, actually, it's not really that hormones cause heart disease or strokes or breast cancer.
Mm-hmm.
It's really that the type of hormones matter, and when you initiate hormone replacement therapy also matters.
Mm-hmm.
So what I mean by that is HRT is not going to cause you to have a stroke, but if you have been without estrogen for 10, 20, 30 years, right? So say your period stopped at 45,
Mm-hmm.
and now you're 65, and you're thinking about hormone replacement therapy, your heart has gone 20 years without estrogen.
Mm-hmm.
And the vessels around the heart respond to lack of estrogen by stiffening up, by becoming more stiff, more likely to have things like heart disease.
Mm-hmm.
And so what that study showed us, the Women's Health Initiative showed us, is that women who have gone long periods of time without hormones, if we then add hormones to the picture, it can speed up what was already happening.
Okay, so we could be doing harm if we wait for a long period of delay to administer hormones.
Exactly. So it's more harmful to wait or to delay initiation of hormone therapy. But if we were to have you at your 45th birthday talking about hormone replacement therapy and starting it, not only can we get you to feel good for that 20-year period between 40 and 60, but we also can help to minimize some of the changes that happen to the blood vessels, right? To your brain, to your bone, so that you're not having osteoporosis and increased risk of heart disease and increased risk of Alzheimer's, because you don't have those changes that happen just naturally without having the estrogen present.
Okay, so this is good information. So you just mentioned several types of symptoms or things that could happen without estrogen. And so when we think about menopause, traditionally we think about hot flashes. That's one of the common symptoms, and mood swings. But you mentioned other types of symptoms. Can you dive more into that, Jenna?
Absolutely. I mean, name a point or point to a place on your body and I'll tell you how hormone loss affects it.
Wow.
Seriously. Head to
How
toe.
about bones?
Bones, yeah. So you have hormone receptors in your bones, and receptors are just messengers, right? So they tell the body how to act. For the sake of your bones, they tell the body to break down old bone and lay down new bone. And so when you don't have that relationship happening, you're not laying down new bone, and so your bones become brittle. Or we might diagnose you with something called osteopenia, which leads to osteoporosis, which if we're thinking about longevity and how to keep women safe longer, you know, the things that are taking out the 80-year-old grandmas and aunties are bone breaks, right? Are going to be things like sepsis from UTIs. So again, it's not just, you know, how do I feel better in this moment and how do I help my joint pain in this moment, but also what is that joint pain signifying? And is there something underlying that is happening? So that even if I'm not having joint pain per se, I do want to still protect my bones so that I'm not osteoporotic.
Okay. What about brain?
Yeah. So your brain on estrogen runs well, it works well. You can focus, you can dial in, you know, you're able to multitask if necessary. Your brain off of estrogen, you know, you have memory changes, you have word recall difficulties. So
Hear
walking
that, ladies? Word recall.
walking into a room and being like, what did I come in here for?
Yes.
So that is your
Yes.
brain off of estrogen.
What about emotional changes?
Yeah. So I see a really high uptick in anxiety in midlife. And so I can remember one of my favorite patients came in and she's like, I just can't drive anymore. I'm too anxious. I don't want to drive. I don't want to drive on the fast highways. Everybody is crazy around me. And so this was just like one thing that she could point to say how perimenopause was impacting her, but her anxiety had skyrocketed over the last couple years as her hormones started to decline. And so your brain off of progesterone can become a very anxious environment. You can have lots and lots of anxiety.
Mm-hmm.
When you don't sleep well, because progesterone is a hormone that really helps with sleeping. If you're not
Mm-hmm.
getting restful, restorative sleep, of course you're irritable.
Mm-hmm.
You know, of course your husband's going to get on your last nerve, even if it's just him breathing, because you
Mm-hmm.
got 4 hours of, whack sleep last night. So
Oh boy.
definitely some mood
Mm-hmm.
influences.
Mm-hmm. From your professional experience, what are some of the most common misconceptions people have about menopause and aging?
Yeah. The most common is that menopause is an old lady disease.
Mm-hmm.
And even more specifically, an old white lady disease, right?
Mm-hmm.
So I have plenty of young Black women that I'm diagnosing with perimenopause, and they
Mm-hmm.
might be in their 30s. And they're
Mm-hmm.
like, well,
In their
wait,
30s.
in their 30s, you start to lose hormones, specifically testosterone starts to decrease year over year in your 30s. And it can
Wow.
happen much earlier for some women. And Black women, we enter into this perimenopause transition earlier.
Wow.
Our
Wow.
symptoms last longer,
Mm-hmm.
so if you are feeling like you're having, all of these vague symptoms, like I just don't know what's going on, and you're talking to your primary care and your OBGYN and your mental health provider and your physical therapist and your urologist, all of these people that you've piecemealed together to build a team,
Mm-hmm.
and nobody is talking to you about hormone changes, I think it's a misconception because those providers just aren't aware that this happens a lot sooner than we are really honest about.
Mm-hmm. Mm-hmm. Wow, that's good information. Now, one of the reasons why this series or this particular topic was so very important to me because I am in menopause, and so I recently started doing hormone replacement therapy, and wow, as a result, I feel better, much better than before. And so I wonder if you can talk about those particular or hormones that are available as you start to go through this particular process. What can we look forward to finding out information about these hormones? So.
Yeah, so the
Hmm.
hormones that we typically use in menopause care are
Hmm.
typically what we call bioidentical, meaning they look identical to what your body naturally produces.
Hmm.
That's different than the hormones that we give you with birth control, for instance.
Hmm.
With birth control, typically we're giving you synthetic hormones, and the goal is to shut down your body's natural production so that you don't ovulate, so that you don't get pregnant.
Hmm.
Looking for soulful music to spice up your next celebration? Meet the dreaded blues lady, your go-to blues singer from Virginia, bringing heart, soul, and a whole lot of power to any event. Whether it's a house party, a birthday bash, or any special occasion, the dreaded blues lady will fill the room with music that touches the soul. From performing powerful blues and soul at your events to singing background vocals on your music tracks, she's got your musical needs covered for any project.
I can't be satisfied, and I just can't keep from crying.
Book the dreaded blues lady for your next event and bring the power of blues, soul, and inspiration to your celebration. Visit thedreadedblueslady.com or email info@dreadedblueslady.com today.
The Dreaded Blues Lady. Soulful music, powerful stories, unforgettable moments.
Just can't keep from crying. Lorie, out loud.
But with menopause, we don't necessarily want to strip you of those hormones so that you are preventing pregnancy. We want to supplement those hormones so that you don't have these high highs and low lows, these
Hmm.
peaks and crashes that cause a lot of the symptoms that you feel. And so we're giving you bioidentical hormones, meaning
Okay.
again that it looks exactly like what you naturally produce.
Hmm.
And the main three that you'll hear about are going to be estrogen. Estrogen, I like to give through the skin or at what we call a transdermal approach.
Hmm.
When we do estrogen through the skin, we bypass the risk of blood clots. So the same way you take the birth control pill that has synthetic estrogen, it's broken down by the liver, it increases clotting factors. So you have an increased risk of blood clots. The same thing will happen if you were to take the estrogen for menopause by mouth.
Okay.
So that risk is typically small in the average person, but for most women, I just want to bypass that risk altogether. So we'll do estrogen through the skin. So that's a little patch that goes on your belly, and you would change it, or you put it on your butt, and you would change that twice a week. So like a Monday, Thursday schedule. So that's where you get the estrogen. Estrogen is great for brain health, so it can help with the brain fog, temperature regulation to help with the hot flashes, the night sweats, joint pain. It is the thing that can help you sleep through the night a little bit better. And then estrogen drives growth. So it is, again, the growth hormone that's helping you when you want your bones to be strong and healthy. It also is going to cause growth of the lining of the uterus. So when we give you estrogen, it can cause some bleeding. So that's one of the things to be looking out for when you first start hormone replacement therapy, is that you might have spotting or heavier bleeding.
Okay.
So whenever we give you estrogen, because that bleeding risk is there, because that growth of the uterine lining tissue risk is there, we have to combat that by giving you progesterone too.
Okay.
So estrogen typically is going to be a patch through the skin. Progesterone is going to be a pill. It's not associated with increased blood clotting risk, so we can take that safely as a pill. You take that every night, and it's great because it's a relaxation hormone, so it can help you to fall asleep better. So if you're having insomnia, progesterone can be incredible to start the nightly pill to help with that. Progesterone is also one of the things that leaves early in the perimenopause transition. So lots of women in that early transition will come in with like super heavy bleeding or even recurrent miscarriages. And oftentimes that could be because of progesterone deficiency.
So you could potentially have a woman in her 40s start on progesterone pills?
100%.
Wow.
Their
Wow.
30s.
In their 30s. Wow. See, this is good information because, again, I'm thinking, you got to be in your 50s to get this thing going.
Nope.
Wow. So you can begin having symptoms of menopause, or in this case, perimenopause, in your 30s or so.
Yep.
Wow.
And when to initiate therapy is when you are distressed enough by it, right? When you're fed up enough to be like, I don't want to deal with this brain fog and joint pain and decreased sexual desire and painful dry sex and all of the, I don't want to deal with that anymore. That's the point when you initiate therapy.
Now, talk more about those symptoms, the sexual health types of symptoms, or the I guess the libido or performance, things like that. Can you talk about that, Jenna?
Yeah. So pelvic health is kind of the bread and butter of my practice, and that's actually how I ended up doing hormone care in general, working in urogynecology, so the world where the bladder and the vagina meet. So initially when I started my career, I was seeing women with recurrent urinary tract infections, overactive bladder, dry, painful intimacy, and very quickly realized like, oh, these women are also having other symptoms of hormone decline. But early in my career, I felt very comfortable starting them with local therapy, so estrogen and testosterone, because what happens is when the vulva, so the outside of the vagina, lips, labia, clitoris specifically, when that tissue loses estrogen and testosterone, it becomes thinner.
Yes.
So you can start to see that your labia can actually disappear. Those inner labia can get a lot smaller than they used to be. Things can be a lot more red, more irritated.
Wow.
More dry. And that's because estrogen and testosterone are the markers that really drive blood flow to that area. So when you don't have estrogen and testosterone, you don't have good blood flow. So then you have thinning of the tissue, drying of the tissue. Then you have those symptoms, the UTIs, the overactive bladder, the leakage, the pain with intimacy.
Wow.
And when we talk about desire, if you're having dry, painful sex, who wants to have more of that, right?
Hey, beautiful people. It's Lorie Gina Combi, your host of Lorie Out Loud. I've only been podcasting for about 6 weeks now, but I'm pouring my heart into every episode, and I hope you've been feeling the love. Well, After finding out that my advocacy work of 18 years is being eliminated, Lorie Out Loud has suddenly become more than a passion. It's part of my new beginning. If you're enjoying the journey so far, I'd be so grateful for your support. You can contribute through Cash App at $Lorie Out Loud. That's $Lorie Out Loud. Every little bit helps me keep going, growing, and sharing out loud. Thank you so much.
Lorie Out Loud.
Now, you mentioned testosterone. And again, when we think about testosterone, we think about that as being a male hormone, of which the females have nothing to do with. So can you tell us, set us straight on this topic as far as testosterone and its role in our health?
Yeah, absolutely. Testosterone is a human hormone.
Mm-hmm.
And so that means that humans of all types, male, female, and everyone in between and outside of that binary has testosterone.
Mm-hmm.
Yes, it is true that men have more testosterone on average than women, but testosterone is very important for women's health too. And so when we think of it as only a male hormone, we miss out on all of the goodness that comes with testosterone therapy and replacement in women. So that could be things like the big body of data of evidence that we have are tied to desire, so sexual desire. As your testosterone decreases, your libido or your desire to be intimate starts to decrease. And so that could be a really great tool. Replacing that testosterone can be a great tool for someone who maybe her partner has gotten Viagra. She's not necessarily having pain anymore, but her brain doesn't have that want anymore. She may want to be intrigued. She may want to want, but it just is not firing for her.
Yes. Okay.
So desire is super helpful for that.
Yes, for sure. Now, let's go off a little bit off the beaten path and we'll come back to it. But tell us, Jenna, when did you decide that you wanted to be a women's health nurse practitioner?
That's a good question. I don't think I ever decided it. It was just like what made sense for me, if that makes sense. My grandmother was a healer, so she was a reverend and a folk healer. So she raised me, and I saw people coming in and out of the house for healing all the time. So that is just what I knew people to do for work.
Yes.
And so when I got to college and then when it was time to apply to college, I was like, okay, how can I do this? And so medicine and nursing seemed to be the logical route to take. So I ended up going to University of Pennsylvania, really great school of nursing in Philadelphia. And I never had to make a conscious decision to do women's health because I think I've just always been a girl's girl. My mom was one of 5 girls, so I always was surrounded by aunts, and I just saw how sisterhood was so important to us as a family. And so I've always had really strong female relationships. I'm a member of a sorority, and so when it came time to kind of choose who it was that I wanted to dedicate my career to and my care to, it was obvious that it was going to be women. It was going to be my sisters, And so, applied for my master's and did my master's in women's health and gender related. And it was just an obvious fit because of who I am and my philosophy and who I care for. I've always been a girl's girl. So I'm like, I got to treat the girls. The girls need care.
Yeah. Great. And thank you so much. Now, you talked about earlier that there is evidence that menopause is affecting women of color or Black women differently, like the symptoms last longer. We start get symptoms earlier. Now, we know that racial bias in healthcare is real. And so have you seen how menopause symptoms are dismissed or misdiagnosed in Black and brown women?
Yeah, certainly. If you are a part of a population and you're having symptoms earlier or sooner, You might not be believed if you're 35 and you go presenting with night sweats and hot flashes. Your
Mm-hmm.
provider might be like, you're too young, you know? And so if we just look at the pure data and we see that Black women are going to be that subset of women entering into perimenopause and menopause earlier, those are the women that are going to be suffering from that unconscious
Mm-hmm.
bias of age.
Okay. Okay.
And then I think that just having providers that look like you is super
Mm-hmm.
important, that speak your language, that understand, when you walk into a room, you don't have to perform for them.
Mm-hmm.
I think that is essential to be able to give quality care. And there are not a whole lot of providers who are women who also happen to be Black.
Mm-hmm. You're
And
right.
so,
You the only, well, two. I've met two, and I'm 58. Two in my whole time, going to, see about myself, going to the doctor, just two. So it's just not a lot of Black and brown practitioners available. Period. Never mind when you talk about this particular specialty.
exactly.
Mm-hmm.
So it's just not a lot of us out there, and so it's not a lot of us advocating for people who look like us,
Mm-hmm.
and being able to translate, right? Because I think that inherently I understand that Black folks don't really care to take a whole bunch of medications, right?
Mm-hmm.
And
Mm-hmm.
so when I'm presenting to my sisters,
Mm-hmm.
I have that built-in knowledge of, let me explain clearly that this is not a medication per se.
Mm-hmm.
This is not a pharmaceutical. What we're doing is replacing what you naturally make.
Yes.
So I think that having that sort of knowledge is paramount to being able to deliver good and quality care.
Mm-hmm. How do you approach menopause treatment? Do you follow a particular model or framework that emphasizes holistic care?
Yeah, so my practice, Discover Health, we have a framework. It's the HER model. So it's
Mm-hmm.
healthcare, education, and resources.
Okay.
And so with healthcare, we really have to focus on time because it takes time to be able to deliver quality care.
Mm-hmm.
Um, and so we do 60-minute consults for new clients and 30-minute follow-up visits for all return clients.
Mm-hmm.
Education is a big part of it. So I want to make sure you have enough time for me to tell you about the WHI study, for you to understand the connection between your hair loss and your libido changes, right? For you to be able to ask me detailed questions about your labs and the trends that you're seeing.
Mm-hmm.
And then the R in our model is for resources. So we have trusted products that we sell too. So it might be like vibrators and lubricants, dilators, things that you might be scouring Amazon for at 3 a.m. when you can't sleep, but we really want to be like that trusted place where it's all in one to know, okay,
Mm-hmm.
these are the quality products that I need.
Okay.
So that's the overall kind of model that I practice under at my practice, Discover Health. And then when it comes to menopause, again, I let the client lead me. So you're telling me what is distressing to you. You are telling me what is high priority. All I'm doing is giving you the tools for you to choose what you are ready for. And so it really just is a different type of collaborative care
Mm-hmm.
versus dogmatic, this is what you need to take.
Yes. Okay. Now, I'm going to go back and touch base on one of the symptoms that you had not mentioned before, but for us, Black women, we love our hair. And so you said hair loss is a symptom of menopause. Can you talk about that?
Yeah, so the same way that you can have tissue loss in the vagina, right? You can see the labia start to disappear because of lack of blood flow. You can have changes all over your body because of lack of blood flow.
Mm.
So in the skin, you have dry, itchy skin, fine lines, wrinkles. In the hair, it could be lack of blood flow to the follicles, and you can have more shedding, more breakage, more hair loss. And so it is very important that when I'm doing my intake, I'm asking specifically about hair loss.
Mm-hmm.
Hormone replacement therapy doesn't have a whole lot of evidence that's convincing that it's going to grow your hair,
Mm-hmm.
but it can certainly help to limit some of the reasons that your hair might be falling out.
Okay. Okay. And tell me, what about some of we talked about HRT, uh, we talked about the estrogen, we talked about the progesterone, uh, but we didn't talk so much about the testosterone and basically the administration of it. You
Yeah.
know, we talked about transdermal with the estrogen, and we talked about the pill for the progesterone. But what are the options for the testosterone?
Yeah, so testosterone, I like to start people on the transdermal approach too. So we do a
Mm-hmm.
little bit of cream once daily through the skin. If that is not enough, we can also do injections where you could do like once a week, you can inject yourself with the
Mm-hmm.
testosterone. And then there are clinics that do pellet therapy. So these little, not really, they're not devices. It's medication that is implanted in your skin, like just under your skin, and then
Mm-hmm.
over the course of a few months, it so slowly delivers the medication. So
Okay.
some people will do testosterone therapy with the pellets. I'm not a huge fan of the pellets. I find that you get sometimes very high doses and
Mm-hmm.
actually have side effects from those high doses. Like if you're worried about your hair, if you have too much testosterone, hair loss is a side effect of too much testosterone too. So I prefer like a daily transdermal testosterone approach. And then we kind of move up to the bigger guns once you need them, if you ever need
Mm-hmm.
them. But most women
Mm-hmm.
do well with the daily cream.
And what are some of the other options that may be available? Again, you talked about different symptoms like for skin or you talked about, I guess, loss of elasticity in your vagina area. Um, are there any types of medications or hormones that you could be utilizing for those particular concerns?
Absolutely. So, one of my favorite things to do is once we get you on HRT, if you're doing great, but you're still having the elasticity issue in the skin, that might translate to like aging. So,
Mm-hmm.
we could do some laser-based therapies and
Mm-hmm.
interventions to help with the appearance of fine
Mm-hmm.
lines and wrinkles for aging. We can use that same exact technology in the vagina to
Mm-hmm.
help with elasticity there to improve dryness and sensation. So we could use radio frequency is a type of laser that we have in our clinic that you can use on the face and in the vagina to what we call rejuvenate the tissue.
Mm-hmm. Mm-hmm.
So definitely some options there. You could use topical hormones. Like I really like to do this estriol. So estriol is a weak form of estrogen, and you
Mm-hmm.
have lots of skin receptors in on your body that really like the estriol. So we
Mm-hmm.
can get the estriol compounded at a specialty pharmacy in a regular like CeraVe or whatever moisturizer, and you can use
Mm-hmm.
that, and that can be super helpful with helping with like fine lines, wrinkles. So it's a topical kind of cosmetic cream or
Mm-hmm.
moisturizer that can give your body some of that weaker form of estrogen
Mm-hmm.
that can really help with the appearance and the lack of elasticity.
Okay. Okay. So, I mean, when you said that this affects your whole body, you wasn't kidding.
Head to toe.
Oh my goodness. It's like, now let me go back. You said one word that kind of piqued my ears up. You said sensation. Oh,
Mhm.
what explain yourself, Jenna? What are we talking about? Increased sensation or what
Yeah.
are we hmm
So when I speak about sensation, oftentimes what can happen is if you have dryness,
hmm
dryness is there, and then the muscles in the pelvis, we'll talk about
hmm
pelvic health, respond to that dryness by going into protection mode by trying to tighten up.
Okay. hmm
And so what that can cause is you can have a heightened sensation. So
hmm
anything that touches it can be painful.
Ah.
A Q-tip, a penis, a finger,
hmm
a tampon, right?
hmm
But you can have the reverse of that that happens too, where you start to feel like when you don't have enough blood flow to the area,
hmm
like you just don't have enough sensation.
hmm hmm
And so both of these situations of like heightened sensitivity and
hmm
also decreased sensation of
Okay.
pleasurable
hmm
inputs can occur.
Okay. Okay. So, wow. Just again, it's lots of good information here. I hope everyone is listening and really learning to the types of changes that can happen with your body, and then also the options that we have available.
100.
Now, are there any particular lifestyle changes like nutrition, movement, or sleep habits that you find especially helpful for women that are going through menopause?
Yeah, one of the things that happens is with menopause, testosterone loss, is that you can lose muscle mass.
Mm-hmm.
That loss of muscle mass can translate to just feeling a little bit heavier, right? Like you
Mm-hmm.
used to have some tone and now you don't necessarily have that same muscle tone. So, lifting weights is going to be essential. I think
Mm-hmm.
that every woman in her 30s should start lifting weights so that she can maintain her muscle mass and even start to build some muscle mass as
Mm-hmm.
time progresses. Um, the other things that you can do to focus on muscle mass protection is make sure that you eat a high protein diet. And so that doesn't mean, eat a steak for dinner every night.
Mm-hmm.
That might look like having more beans every day because beans are going to give you high protein and high fiber, which are great
Mm-hmm.
for your gut health. So
Okay.
high protein, high fiber diet, exercise with weightlifting as your primary kind of source or goal. You can continue to run, and definitely walking is excellent. You should definitely walk. But weightlifting, you really have to prioritize that in order to maintain your muscle mass.
Okay. Okay. That's good information. So then how can patients work to advocate for themselves when they feel like their concerns about menopause or the symptoms that they may be experiencing aren't being fully heard or taken seriously?
Yeah, I would say you just have to be an educated consumer in the same ways that you'd be an educated consumer if you were looking for a new car.
Mm-hmm.
No, if the first dealership doesn't have what you need, then find someone else.
Okay.
I think that Black women in particular, once we find a provider that we trust, or, we're there, okay, they have all our records, sometimes there's some hesitation to seek out a second, third, fourth, fifth opinion.
Mm-hmm.
So I would just say that you have to recognize that not everybody is an expert in this. In fact, most providers are not trained in this at all because it is not required.
Yes.
So when you're talking to your OBGYN and maybe you're met with unhelpful pieces of advice,
Mm-hmm.
don't hesitate to find someone who is an expert, right? And also just having that level of discernment to recognize that some people might call themselves experts in menopause and hormone care, but they aren't necessarily experts.
Mm-hmm.
So just really seeing other people, right? Dating your providers and find
Yes.
someone until you feel like, okay, the trust is there. I've been able to get my questions answered. I feel confident in whatever tools I've decided to use and to utilize. And then if you don't feel better, seek another opinion,
Mm-hmm.
Don't
Okay.
give up. It's not just because one person said, I can't help you or you're too young, it doesn't mean that there's no help for you.
Yes. Now, are there any particular, I guess, criteria or certifications or something like that we should be looking for when we're looking for these providers to assist us?
Yes and no.
Okay.
So I think that the North American Menopause Society, or now just called the Menopause Society, is a great place to start. They do have a provider lookup tool where you can
Mm-hmm.
find providers who have either taken their tests or who are members of the society. So that's a great
Mm-hmm.
place to start. I will say that even within that provider lookup tool, you'll still find providers who aren't necessarily the person you're looking for,
Mm-hmm.
Um, I'm a member of the International Society for the Study of Women's Sexual Health,
Mm-hmm.
ISSWSH, ISSWSH.
ISSWSH.
Mm-hmm.
Okay.
ISSWSH. And all of the providers in Ishwish are going to be, not all, but a lot of us are going to be trained in hormone care because sexual health and hormones are intricately tied. And so if you're looking for someone who is going to be able to give you the care that you need for your sexual health and also happens to know about hormones, I think Ishwish is a great place to land. I think some of the Ishwish trained providers are going to be able to do some of the general HRT better than your generalists too, because they just see it and they feel very confident. We see it and we feel very confident in doing hormone replacement therapy because we do it day in and day out.
Okay. Now, what do you find most rewarding about working with patients who are in this menopause transition?
I would say my very favorite visit is the follow-up visit after initiating hormone replacement therapy.
Oh,
Because
that's the I feel good visit.
yeah, that's the I feel good visit.
I feel good. I knew that I would.
I love
And
it.
we don't quite know, but we're just happy that I'm feeling good. Yes.
You get a lot of surprises. Like I'll have people be like, I was having headaches every day and I didn't even tell you about that. Or like you asked about my headaches and I didn't even recognize that I was having them and now I'm not having them anymore. Or I thought that I had arthritis and my joint pain would never improve and now my joints are feeling better. So that second visit together after starting hormones, that follow-up visit is the most rewarding.
Wow.
Because it's so simple for me. I don't have to do a lot of work. I just gotta write a script and educate you, but you can see results pretty quickly and it is very satisfying and extremely rewarding. So
yeah, I bet. So, Jenna, on a personal note, as a wife, mom, and health advocate, how do you stay grounded while helping so many women navigate this life stage?
That's a great question. I don't think that I'm always grounded. I definitely think, and as an entrepreneur too, oftentimes I'm like, what in the world am I doing? And I can feel, overwhelmed. But because it is so rewarding, the work doesn't feel like work necessarily. It feels like me walking in my purpose.
Yes.
And so I think that's how I stay grounded is creating the space for me to be able to practice in the way that I want to practice and not having a boss say that you need to see more people faster and make more money. I think that really has eliminated a lot of the personal stress that I was putting on myself trying to work in a traditional setting.
Yes. And I mean, that's joy within itself, just right there. You know what I mean? You're doing, like you said, you're walking in your purpose. And this isn't just about the money, What resources would you refer patients to as they look to find out more about menopause?
That's a great question. Yeah, I would say start with yourself. And this might not be the question or the answer that people are necessarily expecting, but you are going to be the best resource. And so what I mean by that is start to actually tap in and pay attention to what you're experiencing and to acknowledge what you're experiencing. So that might look like tracking your symptoms. Every time you have a hot flash, put a little note in your phone. Whenever you're having a headache or joint pain or, you do your hair and you see a lot of shedding, like just start to write that down because what that allows you is it allows you to have objective data to advocate for yourself better so that if you are met by someone who's like, you're too young for that, you can be like, yeah, I might be young, but I had 6 hot flashes, every day for the last 2 weeks.
Yes.
So I would say that you are going to be your best and first resource is actually just sitting down. How am I feeling? What am I experiencing? But then after that is finding someone that you want to partner with. So really finding a provider that you trust that knows what they are doing so that you don't feel like you have to get a PhD in menopause care. I find that a lot of clients come to me and they're already like, I want this and I've done all this research and I want to do, but I think that that's a lot of work for you to do. And if you
Yes.
were to just find somebody that you trust, it makes that job a lot easier to just choose the tools.
Yes. As we wrap up, Jenna, if you could leave our listeners with one piece of advice or an affirmation as they approach or move through menopause, what would it be?
Yeah, I would say the piece of advice is trust yourself. Just really lean into that knowing, that intuition that God has gifted you with. That is, the universe, God signaling you that something is up. Don't gaslight yourself and don't let other people gaslight you either.
For sure. Whew. Now, let's just take a moment to breathe all of this information in. I mean, because it was a lot. And we want to thank Jenna Perkins for joining us and sharing not just her medical knowledge, but her heart for this work. To find out more about Jenna's practice, please visit discoverhealth.com. That's discoverhealth.com. The Facebook page is also called Discover Health, and it's 2 words. And you can also contact Jenna via phone at 202-394-3849. And Jenna, let me interrupt this as well. Can folks also see you virtually? Do you see patients virtually?
Yes, yep. In person, if you want to see me, I'm in Old Town Alexandria. But if you are in DC, Maryland, Virginia, Florida, Massachusetts, Arizona, then I can see you virtually from the comfort of your home.
Okay. And mention those states again.
DC, Maryland, Virginia, Florida, Massachusetts, Delaware was the one I forgot, and Arizona.
All right. Now, that's a lot of states. You can see her out the comfort of your home. So I want y'all to look her up. You know what I mean? If you're experiencing menopause or you got some other issues going on that she's an expert in, check her out. Now, whether you're approaching menopause, moving through it, or simply curious about what's ahead, know this: your experiences are valid, your questions matter, and you deserve support that meets you where you are. We'll be back soon with more science-related topics. Until then, take care of yourselves and each other. You've just been scienced. I'm Lorie Jean Akambi. And that wraps up episode 5 of Lorie Out Loud. From twirling in wax print fashion to bold artwork and women's health truth bombs, I hope you're walking away with your spirit fed and your curiosity lit. If you love today's show, don't forget to follow, subscribe, or leave a review. And most importantly, share the love. Tag us online at Lorie Out Loud and let us know what segment spoke to you the loudest. Until next time, stay expressive, stay empowered, and as always, keep living out loud.
Lorie, out loud.